I see so many professional working mums struggling with brain fog, bloating, and a long list of GI issues. Most people blame it all on stress, which is often a big part of the picture, especially for depleted mamas. But there could be something they are missing, and it could be leaky gut. Unfortunately, most primary care doctors will assume that the symptoms we mentioned are caused by only stress when their patient's GI scopes and blood tests come back all clear. While scopes are important to pick up certain issues, they don't pick up functional gut imbalances like leaky gut that can cause a lot of symptoms, not just gut issues, but also other seemingly unrelated symptoms like skin issues, brain fog, and poor energy, which can really be impacting your ability to mum and your productivity at work. Sometimes their doctor may send them home with a suggestion to take OTC antacids or even give them prescription meds that can make leaky gut worse. This in turn can allow the underlying conditions to worsen without the person realising it. Unfortunately, when leaky gut persists for years, it's one of the main catalysts for autoimmune illnesses or even just those weird, vague cluster of symptoms that can never be diagnosed with regular testing. But the good news is that there are practitioners who know how to test for leaky gut. They can recognise many of the symptoms and provide patients with a healing protocol. So how does leaky gut happen in the first place? While many mums blame stress for their woes, this is only partly correct. It's how you manage stress, along with several other factors that can put your gut health in peril. So stress will put you into a catabolic state where your body starts pulling on amino acids. The easiest way to pull on amino acids in the body is from within the gut lining, which can lead to leaky gut. Gluten is also a huge one when it comes to leaky gut. And not just for people with celiac disease, but a lot of people who have a stealth, non-celiac gluten sensitivity will damage the gut lining in the same way as celiac disease when they eat gluten. Other intolerances and food allergies can be to blame, especially when your antibodies in your gut lining get triggered and you have regular inflammation. Histamine issues or other chemical intolerances can also be a cause. Taking regular medications can also be the cause, as many medications can alter stomach acid, kill protective gut bacteria, and cause issues with intestinal tissues. And another thing, SIBO, can also prompt leaky gut, since they are both happening in the small intestines, and SIBO can cause a lot of inflammation that can damage the gut lining. Toxins, along with poor diet, can also damage the gut lining. And what's interesting is that many people out there have heard of leaky gut and identify with the symptoms, jumping to the conclusion that they have it. But it's really important to get tested first to find out. Often we find that they may not have leaky gut at all, but they actually have something like a gluten intolerance or a fungal overgrowth or a pathogen that has taken hold. So while symptoms for some GI issues can mimic leaky gut, we never guess. We always test so that we can provide you with the best possible care and help you get back to feeling energized, present, and on purpose with your kids and at work.
To go deeper on the topic of leaky gut and the impact this is having on your family, sign up for a free 15-minute discovery call where we can discuss your specific situation. Simply click the button below this video.